Greeting, I'm Dr. Raghda Al-Hajjaji. Today we talk about the practical steps of systematic review and meta-analysis. In general, when we talk about the study titles, the study title should be an informative, concise, and engaging, also summarizing the core aspect of the research. It's important to reflect the study design and balance between being broad enough to cover the research scope while remaining specific to the topic. Very important to avoid unnecessary abbreviations and should be provide an accurate summary of the research, making it easy for readers to determine study relevance to their interest. While we talk about the study object sits as SMART: S specific, well defined and narrow; M measurable, that's mean your goal, and progressive, tractable; achievable, and that's mean it's realistic, we can achieve it, it's real; relevant, align with your progress and with your research objective; time frame, that's mean we have ends and we set the deadlines for our research. Steps of systematic review and meta-analysis. First step, finding the idea. Idea for systematic review and meta-analysis, and it's valid. If sometimes research we have idea for systematic review and meta-analysis, but it's already done by someone and published. So here it's become this is invalid idea actually. But if it is before 2 years, we can do and conduct an updated systematic review and meta-analysis of the same idea. So checking the validity and formulating the PICO, specific population, intervention, conversion outcome, study design included, and time frame. We'll talk about it in details. Formulating inclusion and exclusion criteria, developing the protocol. When we developing the protocol, mostly we should put it in Bros Bureau website. So when put it in Bros Bureau website, that means we work on this protocol. So another researcher see the protocol and didn't work on the same idea. Searching in the databases, we include at least 3 databases. Need multiple databases that's lead to the wide inclusion and cover of our topic. Download the result. Mostly we download the result and remove the duplicate by EndNote. Then download the results on Ryan website to start the screening. We have 2 steps in screening. First step, title and abstract screening, and this is should be done by at least 2 independent reviewer. Blinding screening between 2 independent reviewer. Then after that we conduct a second step of screening. It's called full text screening. That's the article included maybe 50 or 40, so 2 independent reviewer review the full text and decide if it is included or no. If there is conflict between 2 reviewer, so then we need third reviewer or investigator to resolve the conflict. Then formulating the data extraction sheet. We have 3 data extraction sheet and 1 for the analysis. The 3 including summary sheet, baseline characteristics sheet, outcome specification sheet. From the outcome specification sheet, we extract the main data we needed to include in the first plot if it's applicable as a systematic review and meta-analysis. If meta-analysis is not applicable because there is no data aligned to each other or the data in different unit, we can't change the unit between study to study. And if there is a heterogeneity in the presenting the results, so here not applicable to apply the meta-analysis. We just move with systematic review research type. Data extraction And it's very important and crucial step to check the quality of our included research. Risk of bias assessment for each research included in our study, and we will talk about this is in the one lecture in details, because it's very important to know how to check the risk of bias, and there's many tools, but the last updated is the risk of bias assessment rope 2 Cochrane tools, and this is used for RCTs. Analysis mostly by Riveman, and there's another also type of program for analysis. And then final manuscript writing, there is a criteria to write the manuscript. We'll talk about it in also separate lecture. So how to get ideas for systematic review and meta-analysis. In my opinion, the most important tips to get idea: reading and identify the gap in the literatures. Also by consult expert. For example, when we check the idea about DM, here we consult endocrinologist. Also by practicing clinical practice, you found many cases with uncertainty about the diagnosis. We found some rare disease, rare outcome, rare side effect or adverse event. So here all a question for research idea. Guidelines recommendation. Most guidelines recommended for researcher to conduct research in some gaps, and they put it in the recommendation and conclusion for the guidelines. Previous publication in the same topic, conferences and workshop. So, formulating a review question, PICOTT, its most important tips in the systematic review and meta-analysis. If we do it in the right manner, the whole research will be very valid, and it will be sometimes applicable to implementation in the practice. So, the population describe exact characteristic of the participant or subject under the investigation in our research. The intervention we used, even if it's a treatment or it is another interventions or exposure, and should be we should explain in details about the intervention. Comparison, sometimes we have comparison and sometimes we didn't have comparison, but when we have comparison, we need to explain this in our PICOTT. Outcome, mostly we have a primary outcome, and in most of the research I work on it, there is a primary. Sometimes there is also a secondary endpoint. So it's the outcome can be a clinical, patient center, or related to other relevant measurable. Defining a clear outcome, it's very important, and it reflects a clear and smart objectives actually. Type of study included. Most of the valid systematic review and meta-analysis and high-grade evidence it's conducted on RCTs, and it is actually easier when comparing to the systematic review and meta-analysis on observational study. So sometimes we just include RCT, sometimes we just include observational study, and some type of research we include both type, RCT and non-RCT. Study duration, when we start to searching in the databases, and the date of end of our research. So, inclusion criteria: population, baseline and clinical characteristic of our population clearly mentioned. Intervention, the type of intervention, dose and subgrouping, the comparison, and primary, secondary outcome. This is example from one research done before. That's mean, as you see here, the criteria. The population studies involve the adult patient diagnosed with nasolacrimal duct obstruction undergoing to DCR surgery. As you see, it's very clear, very specific. Intervention utilizing pregabalin preoperative analgesia comparing to placebo pills. The outcome, assessing the impact of pregabalin on post-operative pain. This is the primary outcome. So we have another outcome time to the first request of analgesia, duration surgery to total methadone consumption, and also incidence of post-operative nausea and vomiting. Included type of study, just RCTs, as you see. So exclusion, may we exclude not English language articles, not available in full text. Sometime we just found abstract or a part of the study, not the whole study. Posters, mostly we excluded. Review or box, and unreadable for extraction or unreliable for extraction. Here we have exclusion, study involving pediatric patient or individual condition other than nasolacrimal duct obstruction, utilizing intervention other than pregabalin, and without mentioning for the outcome in the study, and so on. So here, for example, for study title, analgesic efficacy of preoperative pregabalin in DCR surgery, a systematic review and meta-analysis of randomized placebo-controlled trial. It's very specific, very nice, and it's very clear. When you read it, you know what we talk about it in this systematic review and meta-analysis. Study objective, we already mentioned it. Okay, so we come here to the searching strategy development. We generally, it's important to come up with PICO, as we mentioned, and we have a keywords. Now we have our objective, study title, and we have also the PICOTT. So need to put or set key terms. This is key terms we used, or keywords used for searching in the databases. We choose the databases, mostly PubMed, and we mostly also use Scopius, Web of Science, and we also using sometimes the Embass. Anyhow, it is not free. The only database is free, it's PubMed. A very important and crucial step, please don't forget to document the searching process. Each website used or databases used, and the keywords, and this all need to document it, and the result total number of studies from each databases. When remove the duplicate, we document the duplicate, and we also document the text, full text screening, title and abstract screening. This is all documented, and even if we exclude some studies, we mention why excluded. This is very important to document it, because we will talk in the next lecture about the Prisma flowchart. For this is Prisma flowchart need documentation for each step in searching strategy. Identify the key term and symbols. Based on the PICOs, you will need to determine the key search terms that reflect each element of the research question. Identify synonyms and variation or related term for each keyword. For example, if our population hypertension, we add hypertension or high blood pressure or arterial blood pressure or blood pressure evaluation. This is, we connect between this by or. And we used and between population, intervention, outcome. Between this is the three, we use and. So the population, we put the population as a keyword. In many variation, we change the word and connect between the population itself by or. But while when we connect between the population and outcome, for example, the outcome cure, and we need and in the connection between the population, intervention, and outcome. But between the population synonyms or variation, intervention synonyms or outcome synonyms, here we used or. As you see here, Berlin operation, and that's mean we need this is also the blue area, or either Bobby or kitten, not just Bobby, not kitten. Actually, not I will not, I use it very rare situation, but we mention, for example, not case control studies, or not we need to exclude something, so we use not. But mostly they used and or. And between population, intervention, and outcome, we used and. But between the population synonyms or variation, we used or. Between the intervention synonyms or variation, used or. Between the outcome synonyms and variation outcome, here we used or. I hope this is clear, because this is very important, and it is the steps need to cover many variation, because we, by this way, we cover a lot of studies included in our search, so we be sure not missed any articles. And to ensure all search terms must be appears in the result. For example, hypertension and treatment, as you see, between the intervention, comparison, population, outcome. So we have, for example, population or intervention and treatment, we used and. But or here allow synonyms or related term to include, for example, hypertension or blood pressure. Not excludes specific terms that may introduce relevant result. We didn't need it. So searching multiple database, it's very important, not just one database. Why? Because some articles published in another database. We used mostly PubMed, Cochrane Library, Embass, Scobius, Web of Science, and Scholar, Google Scholar. The language, you can refine your search by applying a specific filter. I will show you in a practical set. Language filter, publication years, study design, document the searching process as I mentioned before. And that's all. Thank you for your time, and if you have any question, you can contact me. Thank you.